really the greatest joy that I have in my work is the feedback that I get from patients about the impact of the work that we've done on their lives, on the quality of their lives. It is a big deal, and it is important, and it is the main reason that I do it, and it's the main reason I'm the opposite of some of my friends who can't wait to retire. I've got a mate who's very wealthy, works for a London bank, and he's going to retire soon. And I'm the opposite. I love what I do, and I want to carry on. And it's partly I enjoy the work so much, but it's mainly because of the people that I meet and the privilege I have of helping them. And we receive amazing feedback. This is a lovely card from a patient who'd really had a lifetime relationship with spectacles and eye care. Very high long-sided spectacle prescription. And in fact, one of the joys of the Zeiss laser eye surgery platform is it is so good at treating long-sightedness as well as short-sightedness. He's a really charming, very very talented man. He's an architect, and there's this lovely photo on the front of the card. And it says, "From the boy born with ginger hair, glasses and a patch. I've been wearing glasses for 43 years. It'll be a while until I start reaching for them in the morning. Thank you to you and your wonderful team for everything." In brackets afterwards, and so much better than the dentist. And there's a bunch of things that jump out at me here, but firstly, the fact that it's so much of his life reaching for the glasses, and now that's it. It's stopped. And I know for a fact he's on a wonderful trip abroad at the moment, and I know he's going to be enjoying it more because he's just interacting with his environment without having to put specs on and off. It thrills me every time people compliment my team, because it's not just me. The whole ethos of our clinic is that everyone's valuable, and everyone's contribution to the team effort is incredibly important. That's how we get really good results. And the comment about so much better than the dentist is that we talked about that, and I do feel a bit bad actually for my dental colleagues, but I will often say to people, if they're anxious about the treatment being sore or uncomfortable, I will say, look, it's so much better than the dentist. And if you've ever got through any dental treatment, I promise you'll get through this, because it is literally so much better. I live next door to a very nice man who's a dentist, so sorry, Dan. But yeah, that's why that final comment's in there. This is a lovely card. This young man is currently abroad serving his country. So this young man is a member of our armed forces, and it was specifically with his work in mind that he wanted refractive correction. He was short-sighted, and so we specifically selected SMILE laser eye surgery for its benefits of a slightly quicker visual recovery of dry eye symptoms, but also for the strength of the procedure. So this is a flapless procedure, and because this young man is now in an environment where he's got to be at the peak of performance, and so it's a real privilege to look after him. And nice simple message just says, "Thanks for the perfect vision." He's most welcome. This is a beautiful card from one of the first people that we were fortunate enough to treat at the clinic, and there's real care and artistry gone into the card. It even has a nice little sight test chart on it. And this was a charming lady who had early cataract change, but it was really affecting her quality of vision. She was long-sighted, and so needed glasses for distance and for reading. And as you can see, one of her main hobbies is craft work, and and I was thrilled that she came to us so that we could make the most of the opportunity that the cataract surgery presented. We didn't just get rid of a cloudy lens. We took time to understand her eyes and her lifestyle, and we used technology that's achieved complete spectacle independence for her, so that I know that this lovely card was made just at home, but without any kind of glasses, without any sort of any kind of reading glasses. This is a lovely one. This is a lovely card from a couple. So I quite often at the clinic will treat husband and wife couples, and if there's any kind of anxiety to the treatment, if it's elective treatment, it is usually ladies first, and then once the husband is happy that everything's okay, they'll say, okay love, I'll go ahead now. But this is a very interesting couple. They're both doctors, and in fact the husband was unhappy with the result of cataract surgery that he'd had at another hospital. So I don't do it very often, but I am a specialist referral centre for changing lens implants. So if modern cataract lens surgery is excellent, and most people do brilliantly just straight off the bat. But occasionally there are problems, and so yeah, it was a great privilege to be referred this gentleman, and I changed the lens in the eye he'd had operated on, and then he asked me to move on and treat his cataract in his other eye, and we got a lovely result. We got lovely vision for him, and so unusually it was gentleman first, and his wife was so impressed that she booked in for surgery soon after. So this is just a lovely card from both of them. I do feel a bit embarrassed reading out the comments, and I do understand it. So this one says I'm a star, and it says I'm very professional. I like that. But I do feel a bit embarrassed when, and it's very nice, and I'm very flattered when people say things like, "Oh, you're a star," or there's a card that says I'm amazing, and I'm not at all. I work very hard at what we do. My team work really hard at what we do to get really good results, and actually the patients are pretty amazing, because they put their trust in me, and it's a responsibility that I take really seriously, and so I think they're the stars really in the way they let us take care of them, and the way they let us look after them and get the very best possible vision we can for them. This is I really appreciated this thank you card. This was from a gentleman who came to see us at the clinic because he was frustrated with his vision. His main driver that he articulated to us was wanting to get out of spectacles, but actually he was aware that he wasn't seeing as well as he had been, that there'd been a deterioration in his vision. And we undertake a really thorough assessment of every aspect of people's eyes when they come to our clinic. And we do sometimes pick up pathology. We find that actually this isn't just a question of treatment to get a patient out of spectacles and contact lenses. We find that actually there's a medical issue that is damaging or has damaged the patient's sight that needs attention. And sometimes these are conditions that I look after myself in my private and NHS practice. Sometimes they are conditions that are looked after by colleagues, because we're all subspecialised now. So I specialise in laser eye surgery, corneal surgery, cataract surgery, lens surgery. And I have wonderful colleagues that I work with at St James Hospital in Leeds who specialise in retinal pathology, medical retina, surgical retina, neuro-ophthalmology, and I'm very lucky to work with them, and I can access them quickly and efficiently and help people. And this was a gentleman who I referred on. He needed medical care for a condition that was affecting his retina. And I was really touched. He took the time to write, and he said that he understands that the problem he had couldn't be treated with laser, and he greatly valued the extensive tests and my opinion and the help that I gave to take his care forward. Thank you again, and congratulations on the excellence of your clinic. And again, I love that because it's not just me; it's my team. It's the processes and the equipment and their care, as well as the care that I deliver, that's reflected in that card. So that's really pleased with that. And then this is from a really delightful, outgoing lady on whom I performed lens replacement surgery. She had early cataract change, and that's what we're looking for when we recommend that treatment. So in addition to cataract that was affecting quality of vision, she was long-sighted, needed spectacles for everything. And this increasing need for glasses and increasing compromise on her quality of vision is reflected in the thank you. Huge thank you for your exceptionally good treatment and aftercare. Having had lens replacement has changed my life completely and given me back so much confidence in everyday life. Every aspect of the treatment was A star. It was a star. I hear that a lot from patients, this word confidence. These are patients in their 50s and 60s, sometimes early 70s, and the increasing need for spectacles that on offer 3 different pairs of glasses, the quality of vision not being as good because their cataracts are forming, and it nibbles away at their quality of life and undermines their confidence. And confidence, that's such a key word that really has such an impact on how we are, how we conduct ourselves, how we interact with others, how we feel about everyday lives. And so to receive a card like that from a patient afterwards, where she's used that word, that it's changed my life completely and given me back so much confidence, that means the world to me. Because although we treat people's eyes, we genuinely want to know what it is that's brought them to the clinic, what's the frustration that's impacting on their lives, because that's what we're fixing. Yes, we're treating their eyes, but what we're fixing is the problem that's impacting on their quality of life. We want to improve their quality of life and give them back their confidence. I invite you to please sign up for our course on how to choose a laser eye surgery clinic. It's a framework that will guide you through the steps required to help you make the best possible choice for your provider so that you can receive the best possible care.